Welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat, and I'm honored to be joined by Dr. Jessica Vernon today. She serves on the board of Postpartum Support International, and I'm so glad that I've been able to get to know her and see the passion she has for this work. In our chat today, she's going to be talking from the perspective as an OBGYN and somebody who's trained in perinatal mental health. What are some of the important things that she would say to someone who's about to have a baby? What is the biggest reason that people struggle postpartum, and why she thinks people aren't being honest about the realities of birth and postpartum. We're talking about other things as well, like matrescence and myths surrounding postpartum recovery. And she has encapsulated all of this and more in her new book, Then Comes Baby, an honest conversation about birth, postpartum, and the complex transition to parenthood. And Jessica has a lot of experience as an MD. She's an OBGYN. She's perinatal mental health certified and has cared and supported thousands of people throughout their reproductive journeys over the past 15 years. She's Associate Medical Director and Director of Mental Health at ULA, a midwifery-based women's health startup in New York City. She's a mom of two and brings her lived experience with the transition to parenthood into her work. She has a deep passion for providing holistic, people-centered, culturally humble care, and has developed programs to increase access to perinatal mental health care and improve health equity. And I'm so glad that somebody with her expertise and experience has written a book that has real support for new parents. And this being Dr. Vernon's second time on the podcast, I'm so glad to welcome her back. So let's meet Dr. Vernon. Welcome, Jessica. Thank you so much for being here.
Thank you so much for having me back. I've been so excited to come back and talk to you again, even though we get to see each other in other regards.
I know, but it's nice to being on the board together is awesome because we get to know each other a little bit more and definitely hang out. But we haven't been able to do a deep dive on this book that you wrote that I'm really excited for you to talk about today, especially because of how important I think it is for somebody who is an OBGYN to have the training in perinatal mental health and a real understanding of it and is integrating it into their practice. And so, yeah, I'd love to first start there, just talking about that how you integrate those things together.
Sure. And it all came from my own lived experience. I
Mm.
didn't used to do this. And after my own experience, which brought me to the work and also brought me to the book, was how little I knew when I went through my own postpartum anxiety, depression, and OCD, even as an obstetrician who'd been practicing for over a decade and seen
Mhm.
thousands of women and cared for them from pregnancy, birth through postpartum.
Right.
So after my own experience and I got my own treatment, I really wanted to be able to have these conversations with my patients. And once I started having the conversations and they were opening up to me because I was asking the right questions,
Yeah.
then I didn't have anywhere to send them because all of our resource lists were always outdated, or insurances didn't have a lot of places and they were
Right.
booked, or
Right.
they weren't perinatal specialists and they just didn't feel comfortable managing people in pregnancy and postpartum. So I got the comfort and knowledge and skills to be able to diagnose and treat people with uncomplicated anxiety and depression as well, and learn which people needed to go to the psychiatrist, people with
Mhm.
ADHD, bipolar, other things that as a generalist, I can't manage myself. So I developed a really good working relationship with reproductive psychiatrists and psychiatric nurse practitioners. But I really love having a more holistic lens and being able to acknowledge and validate and talk to people about perinatal mental health now. And it's just opened up my eyes to so much more, everything from getting
Right.
pregnant, infertility, miscarriage, all
Hmm.
the way through pregnancy complications, birth trauma,
Right.
postpartum mental health. There's so much that's just not being addressed that we're just starting to look at more as obstetricians.
Right. It's great. The last time we spoke, I know that at that time, there were some more people getting on the bandwagon of trying to integrate the two. Are you continuing to see that trend?
I am. I am now at a practice that's midwifery based, which is really cool. It's called
Mm-hmm.
ULA and it's a women's health startup. And the midwives are great at integrating mental health. They really bring in mental and emotional well-being and look at people's social situations as all part of the experience. But I've still continued to work with the residents at the hospital I'm at now, and they are a lot more open and excited to learn about these aspects of things, which is also why I was doing work with the National Curriculum for Reproductive Psychiatry to help create curricula to train OB residents to be able to do the sort of work that I'm doing, because the next generation, they're always more optimistic and ready to get out there and make change. And it's really great. But a lot of my colleagues as well have started to get more comfortable about having these conversations and prescribing medication and getting people the right resources they need other than medication. And of course, PSI has been a great place to send people and also to collaborate if we do need a consult with a reproductive psychiatrist and don't have anyone readily available.
For sure. I want to go back to something you said too. You said you treating uncomplicated perinatal anxiety, depression. What can you say more about what that means in terms of your
Yeah.
practice?
Yeah, so general OBGYNs, also primary care providers, were really competent and able to treat people who have a mild, moderate anxiety, depression. We can prescribe antidepressants. We can counsel on the risks of the antidepressants versus not taking them. For people who have more severe situations, people who have a history of like suicidality or are just severely depressed, that they may need a more intensive, like regular in-person therapy and visits with a psychiatrist or an inpatient, outpatient type program. They really need the oversight of a psychiatrist who's doing that every day. And also people who have more complex situations like bipolar disorder, which we know is higher risk for things like mania and psychosis postpartum. They really need to be under the care of a psychiatrist. And we're also seeing a lot more women now, that more women are being diagnosed with ADHD who are on stimulants and deciding whether or not they're going to stay on them during pregnancy and whether or not they're going to take them postpartum. And so if they're starting or changing their medications, that's something that a psychiatrist has to do as well.
Yeah, I think because mental health and physical health has been so siloed in the past, a lot of people wouldn't expect an OB to be able to, one, recognize and then treat, as you said, uncomplicated depression or anxiety. But it is so important because I'm sure it's like waits for to get in with a psychiatrist can take a while, or even a therapist. And if they're already coming to you for their regular visits, it's such an important check-in point. But, to not have to wait for a super long time to get access to that kind of support.
Yeah. And it also normalizes it when your
Yeah.
provider is, this is so common, I can help you with it. It takes away some of the stigma and shame. But the other thing is with primary care providers, some are comfortable in pregnancy and some are not. And so I get a lot of patients who've been on like the lowest dose of a medication and they're only having follow-up every 2 or 3 months.
Oh,
And so I'm seeing them in counseling, like how we need more frequent visits and how we might increase their medication more and more actively during pregnancy or postpartum to get them feeling better, depending on what's going on.
yeah, absolutely. I just can imagine being in it with as your patient or in an office like yours with an OB who would ask these questions, being taken aback in a good way that somebody was asking these types of questions. It's because it's not yet widespread enough. I assume a lot of people are either seeking your type of support out specifically or just really happy to have a place that feels like, okay, they know what's going on.
And a lot of the people who tend to seek out midwifery care, like the practice that I'm at now, are people who have had a history of anxiety or depression or bad birth experiences or medical trauma. And so they really need that full emotional and mental health support as well. And it's been great collaborating with the midwives because they are often people recognizing the patients who could use that extra help and making sure they get to the support groups and the therapist and medication when needed.
It's so cool.
Yeah.
You had mentioned also when we were talking through this that some of your, or maybe a lot of your experience led you to writing this book. How did this
Mhm.
come about?
I really felt that I'm someone who's very privileged when it comes to the resources I have access to and the knowledge I have around pregnancy and postpartum. And even I was so shocked and blindsided by my own postpartum experience that I thought if this could happen to me, what about everyone else who doesn't have access to these resources and this knowledge and training? And so when I started doing this work and seeing people for mental health visits and incorporating mental health checks into routine visits in pregnancy and postpartum and talking to people immediately after birth when I'm rounding on them postpartum, there were so many of the same common themes that kept coming up over and over that were areas that my patients had been unprepared for. They hadn't anticipated what happened to them, even if they knew it happened to some people, or they just had never even heard of and just thought they were alone. And just having someone say to them, this is really common. You're not alone. There's support. It will get better. It's just a weight is lifted from them to know that there are other people. And so I really wanted to write this book to bring all of that knowledge to people who don't have access to a provider to help them with this, and also to help prevent some of it before it happens. Because if you're more prepared and aware of, hey, I might need a C-section, what does that look like if that happens? And also knowing that it doesn't mean there's something wrong with your body or that you did something wrong to end up with the C-section. Those sort of things are so important to know before going in so that we're not trying retroactively to recover from the parts of it that we can prevent.
For sure. You're able to meet with people during pregnancy, so some of the
Mhm.
stuff you can maybe catch is happening at that time. And then a little bit of a shorter window postpartum, unless there are some complications. So you get a lot of time with people to as they're heading into the other part of the transition once the baby gets out and
Yeah.
postpartum is around. What are you seeing are the biggest things that parents are struggling with postpartum?
Yeah, there, I mean, there's the physical, the emotional, and the mental, all the different layers from like postpartum recovery not going how they anticipated because they see so much about bouncing back and
Right.
people's bodies looking like nothing ever happened. And it seems that they're just
Ridiculous.
back to normal way quicker than is really realistic for most people. Even and then there's coming to terms with how your body has changed
Right.
and parts of it that are going to always be changed versus when can I get back to what will be my new normal physiologically. There's the breastfeeding, which is huge. I've talked some to the people who did started Fed is Best, which they now have a book out, but it's a really great organization, which is in alignment with my philosophy on as long as your baby's getting fed,
Yep.
that's the most important thing. And your baby needs you to be there and present more than they need breast milk. But so many people struggle and just
Yeah.
try to exclusively breastfeed, whether they are having pain or infections or the baby's not latching well or they just don't make enough milk to exclusively breastfeed. But no one's even told them that 15% of people will never exclusively be able to breastfeed just physiologically, even if they're doing triple feeds around the clock and not sleeping and mentally decompensating, they won't get enough milk. Of course, we know that.
15% is a
Yeah,
lot.
it is a lot. It's a lot. And there's other things too. Like you just
Yeah.
might not enjoy it. And it's okay to
Right.
not enjoy it and to say, I'm going to stop or I'm going to do combination or these other things that a lot of people just feel so guilty and feel like they have to push through and do exclusive breastfeeding. And then, of course, we know the mental health aspects, the perinatal mental health conditions that are much more than just the baby blues and the postpartum depression that a lot of people are taught about. And so many people are struggling with anxiety and OCD that they just had no idea. And they also don't know ways to prevent it. And so I talk a ton with people about sleep and support
All right.
systems in place postpartum.
I
So,
guess in my questions also, I'm assuming that this is stuff you go over in the book and that people are getting this
yeah.
information in there too.
Yeah, yeah. And then, of course, there's the emotional aspects and having feelings that don't correlate with what you thought you would feel and think, and then thinking you're a bad mom because you might not feel immediate, undying love towards your baby. You might not have that
Mm.
intense connection and bond that you're told you should feel. And every day is not bliss. And sometimes you run away, want to run away. And
Yep.
like, all of these things that people feel the shame and the guilt and start questioning, maybe I shouldn't have been a mom because I don't feel like people say they feel, and I don't
Mm.
look like how people look on social media when they're with their baby. validating all of those feelings too. There's just so much of it
Sure.
that isn't brought to light in regular conversations.
Do people, gosh, I know it's hard because you also have like limited time to really get into a lot of stuff with people, but do you find that people are opening up a little bit to you in their appointments about why they're not wanting to be more honest with people around them, or why it's even hard for them to come to terms for themselves how they're feeling?
Yeah, and I'm also seeing a lot of people for mental health visits postpartum.
Mm.
So I do get that extra space and
Oh,
time with some
nice.
people. I'm also doing routine postpartum visits. And then when I'm seeing people in the hospital in our practice, the OBs are rounding on everyone who had a C-section. And so I see them immediately after, and we'll talk a little bit about the birth experience and how they're feeling. I think once you give people permission to feel other things and think different things just by saying, oh, that sounds like it was really hard, or tell me
Yeah.
more about that, or
Yep.
just using language like you do as therapists as well to
Mhm.
give people permission to have
Sure.
those feelings and emotions. And when I first started doing this work, I was always telling my medical assistants in the office, like, you need tissues in the room because once people are able to open up, they just let it out and they
Mhm.
share all of those feelings. But yeah, it's often society puts so much pressure
Yeah.
on moms and new parents to look a certain way and feel a certain way and act a certain way. And none of it's realistic, as we know. And
Mhm.
so it's very hard for people to say other things other than, I'm doing great, the baby's doing great, I love
Right.
being a mom.
Oof. Yeah. That I love that you have your residents and talk to them about having tissue in the room, because it's a small thing, but it's a big thing. Like, it's an indicator that you've thought about somebody's needs. And if it's in there, people aren't going to specifically notice it, but if it's not there when they need it, they notice
Mhm.
it. And it's just, whether it's overt or whatever, it makes it harder to open up and feel
Mhm.
what you're feeling if you're not in a room that feels like it's set up for whatever's going on.
Yeah. Yeah. And so many people apologize for crying.
Hmm.
Whether it's I'm telling them, you have tried everything, I'm sorry, but labor isn't going this way, either your baby or your body. We need to think about a C-section. They're like, I'm sorry, I don't know why I'm crying. Like, it is totally reasonable and okay to cry, like whatever emotions you're feeling, and take
Yeah.
the time to process it. And just letting people know that the whole breadth and depth of experiences and emotions is okay, because there's so much going on during this time period and we're so vulnerable. Yeah, I want to cry with people all the time when I see what they're going
Right.
through.
I imagine being a professional who's gone through something and then is also helping somebody go through something that may resonate on some level. One, of course, it's going to bring up some empathy and sympathy. And because you've been through some of this, you do bring that into your work. I assume that like people can really have a felt sense that they are really being heard and understood.
Yeah, yeah. I've learned so much about that from the psychiatrist and the nurse practitioners and therapists that I've watched when they're talking to my patients. Or there's such an art to communication and sitting with someone and holding space that we aren't taught in medical school. And so being in the room with people when you can who are really good at that, you just learn so much that you couldn't otherwise learn.
Yeah, that's for sure true. Even it is a skill, definitely, to be able to sometimes just sit with
Mm-hmm.
somebody when they're crying and to not try and minimize it or fix it or whatever. It's for sure a skill.
Mm-hmm.
And you've brought a lot of your own personal insights into your work as well. I mean, I can tell as you're talking through stuff in ways that your own experience has maybe informed how you support people, but also, I guess, having personal experience, how has it brought in other insights into your work?
It's made me much more human in the work
Hmm.
that I do. I think one of the things that when you're going through medical training and becoming a doctor, it's like you are the expert and they are the patient. And you almost feel that you're supposed to be this like authority and expert.
Mm.
And now that I've gone through all of these struggles and had to be much more vulnerable in my own journey, I feel like I can sit with people more like person to person, human to human,
Yeah.
and not be the authority and they're the patient. We're just two parents talking about the experience of becoming parents and the struggles of that. And it also helps me be like, that's a great question. I don't know. Let me go talk to somebody else about it, which
Yeah.
a lot of medical providers have trouble saying.
Right.
Or this is something that I haven't thought about before, but it is really important and I'm going to think about it and get back to you. Those sort of things. But it also has shown me that I had one experience and there are a million different ways people can experience
Yeah.
pregnancy and birth and
Right.
postpartum. And I've taken care of people being in New York from all different socioeconomic classes, every marginalized community, every culture. And so I'm going to encounter people who have so many different things influencing their journey and their
Right.
perspective
Right.
that I might not have even ever encountered before. But my job is just to listen and believe them when they tell me about how it is to be in their shoes and their experience, and try to make a plan that's going to support them, not in the way that I would have needed to be supported, but how they need to be supported, which is also so important as a medical profession. And all because sometimes you're like, this is what the journals say and this is what the evidence says. But
Right.
sometimes people need you to meet them somewhere else other than just one strict protocol.
So, in that, do you find that what do you see are some of the biggest reasons people are struggling in postpartum? Is it that not knowing that these things happen or not having resources or, yeah, what all is in there?
Yeah. I think one of the biggest things still is that a lot of people come from cultures and from environments growing up where talking about mental health even is a weakness, and you definitely don't go to therapy, you do
Mm-hmm.
not take medication. And so for some people, even coming and talking about it and getting a therapist. I'm so proud of them when they will even go get a therapist. Knowing my therapist taught me this and it worked really well. And it
Mm-hmm.
makes me feel so good that I'm like, look at all you overcame all of those things. And they'll still do during that time, even be hiding in another room because their mom's there helping take care of the baby. And they're like, my mom doesn't believe in any of this. She's here, she's part of the family. And or their partners, they haven't told their partners that they're getting support. And so that's really good to see when people are able to overcome all of those narratives and get the help that they need and realize like they're worth it too, and having conversations with their partner after being basically a solo parent for most of the time, because a lot of people still come from very patriarchal societies where
Sure.
the partner is not doing much. It's the mom's job to do it all. And so them saying, my doctor or my therapist said, I need to sleep more and you need to help out with the baby at night, or we need to
Mm-hmm.
pay for a babysitter sometimes because even though I'm not working right now, I can't do this 24/7. I
Right.
deserve to be human too. And
Yep.
those sort of things I think are common struggles anywhere, but there are definitely a lot of extra layers from different cultural influences where it's particularly strong and they have to overcome a lot just to speak up and get the help they need.
For sure. That definitely makes things more complex. The transition into parenthood is a identity shifting, and there's so many different things to think about. But when you add in cultural factors, that's another layer. If you're like first generation, that's another layer. Even second
Mhm.
generation, sometimes there's still some, what we did in our home country was this. And you might have to be thinking about, okay, what do I want to use and do for this transition into parenthood from my my parents' country of origin or my ethnicity, and what practices am I going to use here in the US or wherever you might be. There's a lot to navigate there just while you're trying to figure out how to be a parent.
Yeah, there's so many layers to all of it.
For sure. In terms of the identity shift, and there's a lot of talk, thankfully, about matrescence and what that is, but a lot of people still are learning about it or just finding out about it. Can you say a bit about it?
Sure. So matrescence is similar to adolescence. It's a period of changes physically, mentally, Neurologically, there's so much going on in the mind and body. And during that time, for people going through matrescence, not only are they having this intense shift, they're also giving birth and having to care for a new helpless little human,
Mm.
which you don't have to do during adolescence. But society also prepares us a lot for adolescence as a big time period in our life. And there's a lot of support and there's a lot of acknowledgement that the way kids think is going to change during this time. The way they behave is going to change during this time. They're going to be discovering who they are. And all of these things are happening along with so many other processes in a person who is pregnant and has just given birth that thankfully people are starting to talk about it and write about it and acknowledge it more. And it's very validating for a lot of us who have experienced parts of matrescence that we're just reeling and trying to figure out who we are in this new identity and mourning our old identity, but feeling bad about that, but also not feeling
Right.
fully like we're moms. And
Yeah.
it's a process that I think is always evolving. And as they're studying it, they're saying if you have a second baby, you go through another matrescence.
Right.
And it's a lifelong process. And then we're raising our kids while going through menopause, which is you're going through two different.
That's
So we're
brutal.
just, yeah, it's just the tip of the iceberg, but it's so exciting. And I think as we have more female scientists and researchers
Hmm.
and female medical practitioners who are working in this space, then hopefully we will get a lot more awareness of this topic. And
Hmm.
ideally, it eventually leads to more support and resources for people who
Hmm.
are going through this time in life.
So, right. I know a lot of the stuff we've been talking about are in your book, but I'd love to hear just what are some of the headlines of the chapter or titles, things that
Mhm.
you do go over in the book.
Sure. The book is divided into three sections. It starts with birth and then postpartum, which is a lot of the early postpartum things. We know postpartum's a year, but this is a lot that you encounter in the early weeks of postpartum. And then the
Mm.
last part is a little section more about matrescence and the changing identity and roles we go through when we become parents. And the first section is more things to be prepared for and know when you're going in to give birth, as well as what it actually looks like when you give
Mhm.
birth, whether you have a vaginal birth or a C-section, going through from starting with the birth plan
Mm.
and then induction of labor, spontaneous labor,
Mm.
all the way through you give birth and then what happens in the immediate postpartum after the baby's out because a lot of people are shocked. Wait, there's still the placenta. I still
Right.
need stitches. There's other
Mhm.
things that can happen. What's going on in the first few days in the hospital postpartum and really just elucidating some of these key areas that people often have questions about and weren't aware of or prepared for.
That's great.
Um,
And I just want to interject here.
yeah.
This is great for so many reasons. One, just people need the information. But there are, I'm thinking of a couple of people just that I've met with that didn't have people around them who, for one, had babies yet. Like they were the first in their sort of pack to have
Mhm.
kids and didn't have a friend group to ask these questions. And also, who's some who had doulas, some who didn't, who could help them understand this, but who didn't have a ton of time to get into all of these questions with their OB or their kind of birthing team. But then there's another layer of, I'm just bringing this out of left field, but people who are newly pregnant for the first time who don't have moms of their own to go to, or any type of other like matriarchal figures, aunts, whatever, to talk to ask questions about, to have a kind of resource in that way, and who are then left without the access to that information in a way that feels like easy to understand or just relatable and that kind of stuff. And it honestly adds another layer to their mental health
Yeah.
complexity of going into this, into birth of their mental health, and potentially adds to anxiety. So, like, it's not a small thing to have that
Yeah.
information.
Yeah, and a big thing that I wanted to do is cover a lot of the topics that I hear people saying, "Oh, I really didn't want to be induced, and my
Hmm.
doctor forced me to be induced, and then I
Right.
ended up with a C-section." Or I thought if I was young and healthy, there's no way I could end up with a C-section. And so, what might happen along the way that these things are recommended to you, but also letting people know like the normal path of how labor and birth and everything progress. And so, if someone's recommending an intervention for you that's not really necessary, also having comfort and feeling more empowered, whether it's like your doula or your nurse or your partner or someone to talk with the provider and be like, are there other options right now? Do I really need that? Helping both ways. And then another key aspect that people have said to me often is like, when they're very pregnant, other people that are their friends or family, or even people they don't know very well, will trauma dump on them and be like,
Yes.
oh my gosh, I had this terrible experience. This is what happens to
Yeah.
me.
Yeah.
So just knowing that's one of a millions of different experiences, and though
Right.
some things are more common than others, there's a whole breadth and depth of experiences. So I don't want people to be scared and like defensive and worrying that exactly what's going to happen to this other person is going to happen to them.
Yes. That's what's so powerful about having information.
Yeah.
Ugh. Yeah. Okay. So
Yeah.
birth and then
So that's birth. And
Mhm.
then postpartum is what goes on in those first 6 weeks when you come home from the hospital. What are normal physiologic changes that you might encounter in your body? What things you should actually call a provider for? But again, so much of it is things that people are like, I had no idea I would have this much swelling or would still have pain that it would be hard to sit down even if I had a vaginal birth, or
Mhm.
just things like with their bleeding and what's that like, or the
Mhm.
breastfeeding. All there's so
Mhm.
many different aspects of it that people just really aren't given the preparation for in advance, and what that looks like
Right.
with early recovery, and making sure you do have support in place and other people helping because you're going to need to recover. And then getting into the chapters on the big issues that we always see, the breastfeeding, the
Mhm.
mental health, postpartum, when you can go back to working out and proper nutrition. And
Mhm.
working out for me is always something that is like a big pet peeve with the bouncing back
Yeah.
and people trying to sell to people, if you do things this way, you'll be able to start working out and your body will look like nothing ever happened by the time you go back to work. And setting realistic expectations for that as well. Sex after baby, which a lot of people, it's like you're cleared to have sex again, but you might feel like having sex at 6 weeks. A lot of people do not.
A
These
lot of
are
people don't.
reasons why your body and your mind, you might not be ready to have sex, and other ways to connect with your partner and have intimacy without the physical sex, but also how to like get reacquainted with your body and know when you feel ready for physical touch, whether it's you touching yourself or your partner touching you. All of these things that are so important that we don't really get into.
Can
And
I ask a question there?
yeah,
Because there's a lot of there's the like sort of physiological, and you're alluding to it too. Or we're talking about it. The physiological 6 weeks, 8 weeks postpartum is that depending on if structurally you're okay to do certain things. I think it's really important that you're differentiating that there might that's just one aspect of being ready and of doing anything, working out, having sex,
right.
I don't know, whatever else is on that list of things you might have had to restrict yourself from. Not that is such a huge important part of matrescence and being in your own process, but of healing and physically, but emotionally, and just being
Mhm.
able to separate out that 6 weeks 8 weeks being like physiologically ready is not the same thing as being mentally, emotionally ready.
100%. And then there's the people who really want to get back to like intense workouts because it's great for their mental health, and
Mm-hmm.
they have to like take that pause and be
Mm-hmm.
okay with, you want to do that mentally, but your body is not ready. And when you do start, you have to go back slowly and
Right.
work on things like alignment and breathing and like
Mm-hmm.
basics so you don't get hurt.
Yeah. Yeah.
I was so humbled the first time I went to work out after being cleared to work out, because I worked out with my whole pregnancy. I had zero core strength, and I was
Mm-hmm.
like, wow, I can't do anything. And that was really hard to
Yeah.
come to terms with that and not be critical of my body and work with my body at a
Right.
pace that it needed to work at.
That is so tough. You do think it's also so amazing how quickly you can, quote unquote, lose strength, lose cardiovascular capacity if you were working out a lot and you had to take a break for whatever reason. But I think when You combine that with, if I can differentiate it between, let's say you had to have a surgery, so you took time off of doing those things, versus you had a baby, so you had to take time off of doing those things. After a surgery, you're not like, oh my gosh, I'm not me anymore. You might a little bit, might take some time to get back into your process and get back to your strength. So maybe a little bit of identity stuff there, but when you become a parent and you're also having to deal with a new person and relationship stuff, you can really feel like you have lost part of yourself there.
Yeah. And trying to work out or be physically intimate while you're also producing breast milk is also a
Mm-hmm, mm-hmm.
really hard thing to get around.
Yeah,
Being out in public or in classes and having milk leak through your shirt, and
mm-hmm,
it's just, I'm not
mm-hmm.
my own person anymore. I belong
Right.
to somebody else right now.
Yep. Yeah. It is a lot. And that definitely is all part of that transition into parenthood.
Yeah.
Okay.
Yeah.
Postpartum.
And then the last part is a little bit on like the major myths of motherhood and
Mm,
these archetypes that we try to fit into self-care, how to set boundaries, ask for help,
nice.
learn to say no. That's so important. Creating community, the importance of that, how we create community, different ways to do that. And just some reminders on not just being compassionate to ourselves during this
Mm,
time, but also to other people we see who have kids and babies. I remember
mm-hmm.
feeling shamed by other parents so many times for different
Ugh.
things when my first was little. And we're all just trying to do our best.
Yeah.
And what everyone is doing is not going to be how you would do it, but
Mm-hmm.
it's okay if somebody's giving formula and you're breastfeeding, but then the person breastfeeding might get shamed for pulling their breast out in public. It's just, it feels like you
Yeah.
can't win during this time.
Mm-hmm.
So be compassionate to yourself, but also to other people, because even though your experiences are so different, it's like one of these common human things that we do. Giving birth is so common, it's so intense and such a
Mm-hmm.
pivotal, vulnerable time. But everyone who's gone through it, like you can look at them and you have something in common with them.
Oh, yeah, for sure. Oh, man, I really, to drive home your point, I wish there was a way for there to just, it just to be okay for people to be doing their thing, however they're doing their thing. It's
Mm-hmm.
really like, I hope we can get to a point where like one person choosing one form of feeding their child versus another doesn't mean we have to have an argument about it. I don't need to do what you're doing. You don't need to do what I'm doing. We like do what's best for the best decision you can
Yeah.
make for the situation you're in with the kid that you have and the
Mm-hmm.
resources that you have, and like
Exactly.
just let people be. That's
Yeah.
such a pet peeve.
Yeah, but I've met so many amazing people and made such good friends around the times that my kids were born, because there is that vulnerable space where you can connect with people in a different way where you wouldn't other times as an
That's
adult.
true.
Going to other like classes or job or whatever, like you might meet people, but rarely are you forming these like deep bonds. But like new
Mm-hmm.
motherhood, it creates those bonds with people if you're willing to open up and share authentically with them. So I really appreciate, even though like I had so many struggles, I also had some people who were like there in the trenches with me at the
That's
same
lovely.
time. And we're still friends, even though some of them have left the city or
Mm-hmm.
doing other things in their life.
That's awesome. That's so important too, to have a group of people, whether however big it is, little or huge, whatever your preference is, really, to be able to identify with, because it's one way of protecting from the sometimes loneliness that you can feel in the process.
Yeah.
It's really important.
Yeah.
You've clearly poured all of your expertise and yourself and your heart and your experience into this book. What are you hoping that people get out of it or take away from it?
I just hope that people realize no matter how this journey, this experience goes for them, they're not alone. There will be some beautiful parts, there will be some struggles and parts that might seem brutal, but this too shall pass.
Mm-hmm.
And no matter what you're going through, like most of it is ultimately out of our control, no matter how prepared we are. And so there's nothing wrong with you. You're still a great parent. You're not a failure if something goes off course from what you expected. And I promise there are other people who've been there before. And if you look, you can find your people and your support system.
Beautiful. Great. Thank you so much for taking time to share with us today. And the amount of effort and energy that goes into writing a book is something. It's not an easy task. So congrats for doing it and putting it out into the world.
Thank you so much. And thank you again for everything you do. Part of my journey started with mom in mind, and I never would have found PSI and the support I needed and then gotten the education I needed without the work that you do. And
Thanks.
you made me feel so seen and validated when I was in the early phases of my recovery. So thank you.
That's awesome. Thank you so much.
Of
It was so
course.
nice to talk to you.
Oh, thanks. You too.
You can find Dr. Vernon's book, Then Comes Baby, an honest conversation about birth, postpartum, and the complex transition to parenthood, everywhere books are sold. You can also get connected with her at drjessicavernon.com or on Instagram at drjessicavernon. Please share this episode, share this information, share her book, and share this episode with whoever you think could benefit from it. I'm sure you know somebody out there who is pregnant or even newly postpartum who could really benefit from hearing this conversation and getting Dr. Vernon's book. And make sure you have followed or subscribed to the Mom and Mind podcast wherever you're listening right now. And if you happen to be in your podcast app now, just click on review and leave a review so that you can help us stay up in the algorithm of podcast searches and make sure that somebody who really needs this podcast and this information can find it. I thank you so much for being with us. Until next time.